Welcome to the Nursing Post podcast, all nursing all the time with Ashley and Rosa. Today we're going to discuss leukemia, and our goal is always to inform and spark conversation.
So we know leukemia is quite common, and I think from a nursing perspective, it's kind of like when I hear leukemia, the first thing I think of is, well, what kind? You know, there's leukemia that most people get that we would call a chronic leukemia that it's like, okay, that's not something that we worry about too much. It's monitored mainly. And a lot of doctors or oncologists will tell their patients, hey, something else will probably kill you before this leukemia does. And then there's the acute leukemia where the person is being, you know, rushed to a hospital to start treatment right then and there because it is life threatening and severe. So I think that kind of understanding a little bit of the differences of them and that there is a very big difference in acute versus chronic is a good way to kind of have a well-rounded outlook and help patients as needed, of course, when you're seeing them in the clinic or in the hospital setting.
Yeah, I think we all have this idea because it's so familiar. We hear it all the time on TV or a lot of medical shows that we watch. So people already kind of know that leukemia is associated with cancer, but they don't necessarily know anything further than that.
Right.
So we're just kind of trying to give people like a little bit more of an in-depth um, without getting into necessarily the couch cushions and digging for change.
Oh yeah, because I mean, we'd have to
We
break
could
them
be here
down
for hours.
individually at that point. Yeah, it's too much.
Yeah. So, our favorite statistics, and of course, we have a few. In 2021, 61,090 people were expected to be diagnosed with leukemia. An estimated 397,501 people are living with or in remission from leukemia in the United States. The 5-year relative survival rate for leukemia has more than quadrupled. That's 4 times, people, 4 times. From 14% in whites from 1960 to 1963 to 66.4% for all races from 2010 to 2016. Approximately 23,660 deaths. Out of that, 13,900 males and 9,760 females in the US are expected to be attributed to leukemia in 2021. From 2013 to 2017, leukemia was the sixth most common cause of cancer death in males and the seventh most cause of cancer deaths in females in the United States.
So I mean, these are hitting top 10. And just to kind of give a little background for those who aren't familiar, leukemia is a cancer of the blood and the bone marrow. That's where your blood is made. And so this is something that can affect anybody, all races, all genders, all ages. But there are people that are more affected versus not, and there are some kind of common signs and symptoms that does vary a little bit with the type of leukemia that you have. So some leukemia is more in children, some are more in adults, things like that. But things like any kind of exposure to radiation, carcinogenics at any age can cause this to happen more so in older people because let's be honest, they've had more exposure. They've been around longer.
You know, the
Um,
saying, if you live long enough, everybody will have cancer.
right, and, I think that we're all exposed to carcinogenic material every day,
Mhm.
but, when you have somebody who is 5, they've only had 5 years versus somebody who's 70, they've
Correct.
they've had 70 more years of exposure. Smoking, of course, we know smoking increases risk of all cancers, a family history of leukemia, and then if you have other blood disorders, polycythemia, vera, that's one that can be linked a little bit to leukemia. There are some. congenital aspects that may make, somebody prone, and that would be Down syndrome, or is that Fanconi anemia?
Fanconi.
Fanconi anemia, thank you, Rosa, and then there's other, medicines and things like that that you can have or be exposed to, especially if you're, being treated for other cancers that can make it more common, and we do see that, and I know that, oncology sees that even more than I have within my nursing careers. I've never worked in oncology.
I haven't either, and I honestly, my heart goes out to, like, all the nurses that do. You have to be, like, a really special breed of nurse to work in oncology.
Yeah, oncology
I
nurses and NICU nurses have my utmost respect because neither one, would be something that I'd want to do.
exactly. I feel the complete same way. So there are some signs and symptoms of leukemia. Um, they can run across the board. Of course, you can have some and not others.
Yep.
It also depends on the stages
Mhm.
of the cancer that you've been diagnosed with. So you may not have any symptoms early on,
Yeah.
but the most commonly reported signs and symptoms are flu and cold like symptoms, tiredness, shortness of breath, while you're physically exerting yourself.
Yeah.
And for some people, that just might be going up a flight of stairs,
Mhm.
or just walking, to the mailbox and back. You have a pale complexion. You have signs of bleeding caused by a very low platelet count. So, of course, the only way you're going to really know that is through labs, but there are also tall tale signs, like if you easily bruise, if you see pinhead sized spots, like
Mm.
petechiae,
Yep.
or if you have prolonged bleeding from like small minor cuts. Some people have mild fevers, swollen gums, um, frequent minor infections like pustules and sores in the anal area, slow healing of cuts, discomfort in your bones and joints, and if you have an enlarged liver or spleen. Like
Mm.
I said, you don't have to have all of these. It's not a
Mhm.
checklist or, checking the boxes of all of them, but you may have some, one, or all.
Right. To go over a little bit of the different types of leukemia. Now, this is not breaking it down to the nitty-gritty because, we would be here all day. But you have acute myeloid leukemia, and you have a, chronic myeloid leukemia, and then you have a chronic lymphatic leukemia, um, or chronic lymphocytic leukemia, and then you have a acute lymphocytic anemia. So there's two, and we abbreviate that because that's what we do in nursing. Your acutes start with A, so it's AML and ALL, and then you have your chronics CML and CLL. And that's what I will do, so that way we won't be tongue tied throughout this this little snippet of information. So the onset, can be similar for some of them, but and the treatment for a lot of these are the same, but survival outcome may not be. So when you're looking at AML, which is of course your acute myeloid leukemia, uh, the average age of onset is about 68 years. It is an abrupt onset because it's acute, and those are your flu-like symptoms: weight loss, petechiae, bleeding, bruising that Rosa was talking about. Your treatments for that: chemo, radiation, targeted therapy, and then stem cell transplant. Now, when you're talking about outcomes for your 5-year survival rate, is what we look at when we look at outcomes for in most things. 27% for people over the age of 20, and 69% for people under the age of 20. So this acute leukemia is not good for adults. Your survival rate's not that great. If you're younger, it is a little bit better. Now, when you're looking at the acute lymphocytic leukemia, the ALL, that is more common in children and adults under the age of 50. Again, it's acute, so it's an abrupt onset. A little bit different, more fatigue, dizziness, shortness of breath. These people appear pale, they're anemic. And they can get recurrent infections, and of course, bleeding and joint pain and bone pain are very big indicators of this. It was one of the things that I had read that I thought was interesting before we had a lot of information is some of the doctors would push on like the kid's clavicle to see if that hurt. And if it hurt, they were like, yeah, this isn't good. So I thought that was interesting because that bone pain is that sensitive. Again, chemo, radiation, targeted therapy, and stem cell transplant are the treatment options. For your survival rate, you're looking at a 40% survival rate in people over 20, and then an 89% survival rate in people under 20. So this is not too bad for the children who are most commonly affected by it. A 40% survival rate we would not consider the most positive in healthcare. For your chronic conditions, these both are more common in adults, CML being age 64 and CLL being age 70. These both have kind of vague symptoms. CML, you may get some fatigue, some, night sweats, weight loss, spleen enlargement. With CLL, most people don't even know that they have it. That's the one that you'll hear doctors say something else will probably kill you before this will. That is not always the case. I had a friend whose father died of that, and they were told for a long time that that probably wouldn't be an issue, but unfortunately, it was. The treatment's a little bit different. CML, you have targeted therapy, chemotherapy, immune therapy, and stem cell transplant. CLL, we do targeted therapy, chemotherapy, radiation, and immune therapy. And then the survival rate is the same. It's 85% for persons diagnosed with both CML and CLL uh, at your using your 5-year survival rate. So a little bit different, but you can tell, your survival rates aren't as great for the acutes. It's much better for your chronic conditions. And, with that, a lot of these chronic conditions are caught when you're going in for like routine lab work. Um, especially CLL, that's one that you go in for your routine physical and then all of a sudden you're told that you have, you know, chronic leukemia.
Well, if you're doing your annual follow-ups, you'll realize that when they do those, they're drawing, a complete blood count. They're
Mhm.
drawing, liver panels and enzymes.
Mhm.
They're drawing all of that. And there's a reason why they're doing that. It's
Yeah.
because it shows your red blood count, your
Mhm.
white blood count, amongst other things. But we all know that if you're consistently doing labs each year and your white blood count is up, that's an indicator, that's a marker something's not right and that you have an infection and your body's trying to help fight it off. So it's just,
Right.
I have to put my 2 cents in here that it's just super important that you continue to do your annual follow-ups and your follow-ups as directed by your provider, because that can make the difference between whether or not you catch it early enough
Mhm.
for it to be treated effectively.
Yeah, and early diagnosis with any disease process is key, and that's been proven time and time again, pretty much no matter what what disease or disorder you're diagnosing.
Absolutely. Ashley has kind of like put together this beautiful diagram and chart that's going to be
Mhm.
available on our website for download, where it's nicely put together. It's just a diagram of the acute and the chronic, the onset symptoms, the treatments, and the outcomes, so that it will be available to anybody who
Yeah.
is interested in having that information. maybe you're new to oncology, or maybe somebody in your family has been recently diagnosed and you just like to have that information with you. So it will be available on our website. As she mentioned, the treatment to most of these are targeted therapy, radiation, chemo, stem cell transplant, and immunotherapy.
Mhm.
And of course, you're going to have, labs done and, some diagnostic studies done to just verify that you have leukemia, like a peripheral blood smear, bone marrow biopsy. You're going to have to go through, some x ray scans and some labs.
Yep. So, one of the things that we wanna touch on, and I know that we've talked about this in a previous podcast, and I couldn't tell you which one it is. Rosa Rosa's much better at that than I am, to be quite honest. But one of the big things, for treatment with leukemia, as you guys heard, was stem cell transplant. And, another part of that is, having somebody be a bone marrow donor. And we had, mm, I don't know, probably last year sometime did also a podcast on cord blood. And I
Hmm.
think we may have even touched on this a little bit during that episode, and I
I
could be
think we
completely
did.
wrong. But, when you go in and you need a bone marrow transplant, stem cell therapy, cord blood transplant, all those things come from donors. And depending upon your ethnicity and, your race and your ethnic background, your match can be 29 to 79%. So that's a very big gap. So we would like to encourage people to donate because
I
it
encourage everybody to
Mhm,
donate, but I am calling out anybody that is of mixed race,
mhm,
that's Black, Latinx, anybody who's just not white or Caucasian,
mhm.
because there's not enough of us that are donating organs, donating blood, donating, bone marrow, and we have the opportunity to help save someone's
Yeah,
life by doing
literally.
so.
Yep. Absolutely, and that's kinda one of those things, we had done a little episode about, a patient with HIV, who who also had cancer, who was cured, and it was a big deal because she was female, 1, and she was of mixed race because it's so hard to find matches. So it is very important, and I know it's probably scary and there's probably some trust issues there, for sure, but it literally can, save somebody's life, and you can actually look into this. There is a website, Be the Match. It was formerly known as the National Marrow Donor Program. There is a number, it's a 1-800 Marrow 2, and that's, 800-627-7692 or bethematch.org.
Visit our website at thenursingpostllc.com for more information and products. You can shop and subscribe. Feel free to share your thoughts and leave comments. And thanks again for listening to the Nursing Post.